for the tailpiece of today's program. She will be coming on shortly. Now, to ensure that every Nigerian has access to good health care services, Honorable Minister of Health, Dr. Usage Anire, has inaugurated a ministerial committee on the provision of health insurance for retirees and the elderly in the country. Now, to speak more on the work of the committee, let's welcome Mr. Linus Awute. He's a retired Federal Permanent Secretary and also a chairman of the Committee for the Provision of Health Insurance for Retirees and the Elderly in the country. Mr. Awute, pleasure to have you with us on the program.
It's my pleasure.
Retirement is treating you very well. You're looking much younger than you were some years ago.
Oh, really?
Nice seeing you. Also with us in the studios this morning, we would like to welcome Professor Mohammed Nasri Sambo, who is Executive Secretary of NHIS. That's the National Health Insurance Scheme. Prof, pleasure to have you with us on the program.
Good morning, viewers.
And Dr. Salman Anas Kolo, Director, Department of Family Health, the Federal Minister of Health, is also in the studios this morning. Dr. Kolo, pleasure to have you around.
Thank you. Good morning, everyone.
Okay.
All right, Kingsley, thank you. Better late than never, they say. So good to be here eventually. So let's me welcome the two gentlemen and the lady that will be joining us for this discussion. So let me start with the PAMSEC. Just give us an idea what this is all about, this expansion that we talk about the National Health Insurance Scheme.
We are talking about management and care of the elderly and retirees. And we are also conscious of the fact that there is no functional national policy that is designed to care for the retirees and the elderly. He talked about me looking better at retirement. I don't believe that. Because what we know is people retiring today, next day they begin to look wretched, hungry, and dying. I think it is in his own good wisdom as a representative of Mr. President in the health sector that the Honorable Minister and his team deemed it necessary to set up a committee of this kind for which I'm the chairman. So the idea is for us to come up with a realistic, should I say, policy that is going to chart a course for this particular problem. First of all, we will need to have a policy. Secondly, we need to also agree amongst ourselves that the retirees and elderly need to be cared for. As it stands today, based on what we have of statistics, there is upsurge in the growth of the elderly in this country, as in many other places. But in such climate, maybe there are some certain cushioning effects, as an outcome of policy that is designed to care for the elderly. But since we do not have, the time has come for us to do just that. Because it is given that between 2012 and 2017, the figure is put at 5.9 million, representing perhaps 3% of the proportion of our population. So when that data is trended, it is also believed that by 2020, where we are today, the figure is 8.9. If you extrapolate that data based on the trend of growth, in 2015, we're going to have about 13% of the population of the country as the aged. So what do you do? That's the question. And you and I are aware that even though there may not have been any specific care system or welfare system for the elderly, but they have also benefited from the general welfare system that we had. that have been totally replaced by what they call market demand. You know, by market demand, you are trying to say that the welfare system should go, and any gesture of that nature must be dictated by market demand. By so doing, you have already taken the right, which we consider as the tenets of civil right, even when you say, oh, the food that people eat when they go to hospital should be taken away.
Okay, let me sorry, Kingsley.
Yeah, I was just wondering, Mr. Linus Awote, thank you very much. Dr. Salma Kolo, I would like you to elaborate further on what the underpinning idea is about this whole idea of a special health insurance scheme for retirees and the elderly. Why single out retirees? Are they retirees from the public sector or retirees from both the public and private? And why the special focus on the elderly? Once we already have a general health insurance scheme that ordinarily should last a lifetime if you continue to pay the premium and you take advantage of the services available.
Right. Thank you very much. Yes, why the focus on retirees? I think it is a quest for us to achieve our vision, the vision of the universal health care coverage, leaving no one behind. If you observe, this has been the focus of the administration, and this is what the Honorable Minister of Health has been piloting to ensure that all citizens of Nigeria, particularly the vulnerable people, which includes the elderly, women, children, adolescents, and as well as the elderly, have access to quality healthcare services at affordable to them, accessible to them, and easily available to them so that we improve their health. So it is out of this that the federal government also decided to ensure that we don't leave even the elderly people behind. As my permanent secretary mentioned, there are now teeming population of elderly people. The elderly constitute almost 6 to 7% of the Nigerian population at the moment. And with the COVID pandemic, we've seen the impact of the infection, of the disease on the lives of the elderly. Majority of those that lost their lives as a result of the COVID-19 pandemic are elderly people, most of them between the ages of 60 and above. So there is needs to focus on them to make them more productive, because they are productive anyway. And also they are institutional memory, so that they can continue to mentor and contribute their own quota to national development. So when we talk about singling them out, actually they are not singled out. They are part of the totality of the vulnerable populations in Nigeria. Just like he rightly mentioned, after retirement at 60 years, you are cut off from healthcare services. And this is the time that they are exposed to a lot of health problems, both psychological and physical problems. It's the time that they are a lot of issues surround them. They are exposed to non-communicable diseases, especially hypertensive diseases, diabetic, and several other diseases. So this is the time that they need much more health care than ever before during their very active period, years in service. So carrying them along, ensure that they are not left behind, I think is the focus of the administration. And then beyond the retirees, we are also looking at elderly that are not even retirees. They are there in our populations. The scenario is changing. In the past, we used to have a very strong family safety net. This is gradually eroding. You find in the villages, you find elderly people, their children are not there to take care of them. Even if they are abroad, they send the money, but the money does not make a difference in them. It doesn't reach them. So by this scheme, I'm sure that my colleague, Dr. Sambo, will talk more about it, is to ensure that a safety net is created for them, even wherever they are, even if they are in remote villages, they should be able to have access to healthcare facilities, be it at the secondary level or even at the primary level of care. So this is the focus of the administration, to ensure that they are well respected, they remain healthy as long as they continue to age, they age with dignity and continue to make maximum contribution to national development. So that is the main reason why we are focusing on them.
Thank you, Dr. Kolo. Quite laudable. But let me bring in the, of course, Professor Nasiri Gambo, Executive Secretary of NHIS. The concern will be who funds this? What are the financing options? And then secondly, what are the health conditions that this scheme, specifically for the retired and the elderly, will cover?
Yeah, thank you very much. In fact, it is in an attempt to address the concern. That is why this committee, this concern you raised, that is why this committee is established. If you look at the trend of health insurance coverage, the formal sector people, that is the employees of federal government or state government or local government, why they have insurance. You enjoy the insurance system until when you are retiring. And as a point of retirement, you are left without cover. So in order to address this gap, that is why the National Health Insurance Scheme, in collaboration with the Ministry of Health, is now coming together to see how we can now come together and develop a program so that we ensure continuity of services by the employees who have been in informal employment and now they are retiring only to drop the services they are getting. So the whole essence of this committee is to now look at the totality of the situation. Can the retirement package of an individual sufficient enough to enable him continue to receive care? Will it not be enough? If it will not be enough, how can we mobilize resources to ensure that they continue to be covered? If you look at the pension commission, there is a provision for an employee to be contributing through the PENCOM, and after retirement, he will continue to enjoy the stipend that is coming from the pension contribution without factoring the healthcare needs of the retirees. So this committee has in it many stakeholders, including the PENCOM and other stakeholders, so that we can now sit down and see how do we take care of those people under retirement. Let me quickly say that the military and the police, the president has given approval. In fact, we have started covering them under the National Health Insurance Scheme. The retirees from the military, the retirees from the police, and even the retirees from the SS, they are also enjoying the cover by the security service. So what of the other workers? That is why we are here to discuss. Apart from the retirees, we are also looking at the elderly, people above the age of 60. And if you look at people above the age of 60, you can divide them into two. There are those who have retired from the service. There are those who have not been in government services, but they have ability to pay premium to continue to get services. And there are those who were never in work, who have never been in work in either private or public sector, but they cannot have opportunity to pay premium to get services. So those people are that are regarded as a vulnerable segment of population who cannot by any means have a means of payment of premium. So what do we do with them? There is under the Federal Ministry of Health provision of Basic Healthcare Provision Fund, which is a fund that is coming from the Consolidated Revenue Account to cover the vulnerable segment of the population. But if you look at the total amount of money that is coming for the coverage of vulnerable, is far cry to take care of all the vulnerable segment of the population. So this committee will attempt to look at this various situation and various scenario to see what are the population of this retiree, what are the population of the aged, how much is required to cover to cover their healthcare challenges.
What percentage are you looking at?
Yeah,
of contribution.
Yeah, even as clear, even as contribution, you are co-chair of the committee, yes. And Lionel Sawute, the former permanent secretary, is also there. Who are the other members of the committee? I'm sure probably it's a large committee. I just want to ask, yes. Do you have on the committee finance experts? Do you have on the committee actuaries? Yes. That's to say, experts in actuarial science, yes. Who can forecast longevity and so on and so forth. And then we can begin to know the population we'll be dealing with from time to time over a period of time.
Yeah, in this undertaking, we are reasonably aware that there are many things that are lacking that we have to be put in place. For example, we have a situation where there is lack of geriatric doctors even. We are also reasonably aware that we will need such persons and also geriatric academicians who will do all these forecasts like you are talking about. But, you know, it cannot come from the blues. There must be a policy on ground that will ignite this type of process. So we are believing or thinking that in the course of our job as committee, definitely we will touch on all this. Because it's not just about what you give to the retiree or elderly, but it is also about how you manage them. Because to my mind, I believe that even the doctors that we have, particularly those who are qualified in internal medicine and family medicine, there's nothing wrong if these people can undergo 3 years courses under scholarship to qualify for this specialized area. Because first of all, that is lacking. Another thing that is lacking also in the society is if a retiree or an elderly person is moving from point A to B, what happens to him? He may want to urinate on the way to that place somewhere because of his own peculiar situation. So what does he do? Again, a retiree, an elderly person going to the hospital, a very old person going to the hospital, you know, what happens when he gets there? Is there any established condition that would recognize his own peculiar situation to be able to handle that? These are not the things we have in the system.
So are you also thinking of are you also thinking of dedicated opticals?
Of course, we are supposed to have also geriatric centers. We're supposed to have trained persons. I spoke about doctors. Yeah, we are supposed to have caregivers in this country with specialized training that is focused on this area of healthcare. So, just like you said, there is a lot that this committee is going to look at, and the committee is well populated and well represented, and we have been given a wide jurisdiction to also give consideration to the possibility of co-opting those that we feel have the inclination and direct bearing on the subject matter to also partake.
Lifespan of the committee?
The committee is not giving any specific lifespan, but as the chairman, during our maiden meeting, I have indicated that we are going to give ourselves a timeline because we do not want to have an endless committee. We do not also want to have a committee that we end up giving recommendations without implementation strategy. That is the extra responsibility we are giving to ourselves to make a difference.
Dr. Kolo, one of the things that Mr. Linus Awuti just said now was to say, look, the committee, of course, will co-opt experts and so on and so forth. My colleague Claire was referencing, look, earlier, do we have a sense of current medical needs of retirees and the elderly? And can we also have an assessment of the future medical needs of these persons? That's one. Second point will also be medical supplies. Where will these supplies come from against the backdrop of medicine insecurity to an extent in the country? Are you going to have to factor all of this in?
Thank you very much. Yes, the first responsibility, the terms of reference of this subcommittee, is to conduct the situational analysis of what exists in the country in terms of what you have said, the number, the magnitude, and the spread and the coverage of the retirees in Nigeria and also the elderly people. And then identify what are their actual health needs. How are they accessing services? What capacity do we have in terms of our healthcare delivery, providing services, reaching the needs of the elderly people and then the old people in Nigeria, looking at it at the all tiers of the healthcare delivery. delivery, the tertiary, the secondary, and the primary healthcare level. So this is part of what the committee is supposed to establish before even making the recommendations. But you know, we are not starting in vacuum. We are starting based on existing strengths that existed in the past. In 2017, a level of situation analysis was conducted in the country. So what we wanted to do is first to gather information that exists and know where to start from. At the moment, as I'm talking to you, it's not that we don't have completely a non-geriatric center in Nigeria. Something exists in the country, though it's not the level of what we want because it cannot meet the needs. University College Hospital Ibadan is one of the centers that have a functional geriatric facilities to care for the elderly people. We also have Benin Teaching Hospital, Port Harcourt Teaching Hospital. At the moment, even the National Hospital is currently providing services.
As working framework to to start up. All right, Dr. Salma Anaskolo, I'm afraid I have to stop at this point. We've run out of time. Director, Department of Family Health, Federal Ministry of Health, thank you very much for joining us. Professor Mohammed Nasir Sambo, Executive Secretary, NHIS, and co-chair of the committee, thank you very much as well. And former retired permanent secretary, Federal Ministry of Health, and chairman of the committee, Linus Saute, thank you very much. And I can assure you that this is a developing story. We'll keep an eye on it here on NTA. All right, Kingsley.
For those who are in the bracket, it's good news actually that they're working on this.
You know,
all right,
Kingsley,
so you're looking at me with surprise, Prof. You shouldn't.
But Kingsley, I just like to say that the traffic, because that's the reason why we came.
All right.